We are very happy today to have Dr. Dany Doiron, who's a research associate in the Respiratory Epidemiology and Clinical Research Unit of McGill University Health Center. Dany finished a PhD in epidemiology from the University of Basel in 2019, where he studied the respiratory health effects of ambient air pollution using large cohort studies and exposure databases. Since 2016, Dany provides expertise on linking environmental data to confidential health databases for CANUE, and I do believe he's going to start his presentation with a bit of introduction to CANUE. So Dany, please go ahead and unmute and get started.
Great. Can you hear me okay? Good. All right. Well, thank you, Sarah, for the invitation and for the opportunity to present CANUE and some of the work we do today. Here's a summary of my presentation. So I'll start by giving a brief overview of the Canadian Urban Environmental Health Research Consortium, or CANUE, initiative. I'll then present a recent research project that I led, which makes use of Canoe Data to explore spatial distributions of environmental exposures and environmental equity in Canada's 3 largest cities. And I'll finish by outlining Canoe Data holdings and how to access them. So if you can launch the first poll question, Sarah. I'll just wait until people...
I'm actually going to let George do it.
Okay. So I can't see, oh yeah, there we go.
All right.
Excellent. All right, so I'm happy to see that most people have not heard of us, so you'll learn something today. So CANUE is a CIHR-funded initiative with the broad objective of facilitating environmental health research in Canada and advancing our understanding of environmental determinants of disease. We achieve this in a number of ways, but most of our efforts are focused on building a central data portal to host and distribute environmental exposure metrics to Canadian researchers. To date, we have collated and generated over 30 exposure data sets indexed to all Canadian postal codes and ranging in years from the 1980s to today. So this represents over 800,000 data points per exposure year. CANUE has a broad focus on outdoor environmental exposures and urban form metrics, and these include area level socioeconomic information. So we host and distribute postal code level index data on ambient air pollution, greenness, measures of walkability and proximity to amenities, as well as climate and weather metrics and deprivation and marginalization indices. So we provide these data sets directly to Canadian researchers free of charge, but in order to get exposures to as many researchers as possible, we've developed partnerships with Canada's largest observational cohorts and administrative health data custodians. And these collaborations have allowed us to link Canoe Data to health databases using the 6-digit residential postal codes of study participants or individual records in admin health databases. So pre-linked Canoe Data can now be accessed via CanPath, which is the largest population-based cohort in Canada and has recruited over 300,000 Canadians. The Canadian Longitudinal Study on Aging cohort with over 50,000 individuals from across the country, and the childbirth cohort. In terms of administrative health data holders, pre-linked Canoe Data can be accessed via PopData BC, the Manitoba Centre for Health Policy, and the New Brunswick IRDT. So I'll talk a bit more about Canoe Data access at the end of my presentation. So to date, Canoe Data has supported over 200 research projects from universities across the country. And this slide shows examples of some of the environmental health research projects that Canoe Data has facilitated over the past 4 years. So as you can see, these projects cover a vast array of exposures, so from air pollution to greenness exposure, climatic factors, and active living environments. And these projects have also explored environmental exposure associations with a number of different chronic and acute health outcomes throughout the life course. So we've supported projects ranging from maternal and early life exposures to air pollution, all the way to urban factors enabling healthy aging. George, you could send the next poll question, please.
So everyone's answering, great.
Seems to be working, yeah.
We'll leave it go a little bit longer. We've got about 75% here. Okay, I guess we can end the poll here.
Great. Good.
And share the results.
So it's good to see that almost half of you do use environmental exposure or urban form data in your research. Hopefully this presentation will encourage you to access Canoe Data for your research. In terms of research outputs, Canoe Data has supported 6 student theses and 41 peer-reviewed publications so far since we launched in 2016. And this research productivity is really gaining momentum. So over half of these 41 manuscripts have either been published or are scheduled for publication in 2020 alone. So now for the second part of my presentation, I'll outline findings from a recently published study that was led by Canoe staff and collaborators to illustrate how Canoe Data can be used to explore environmental equity and spatial distribution of environmental exposures in urban settings. So the general aim of this study was to look at intersections of multiple urban exposures in Toronto, Montreal, and Vancouver, and how these exposures are distributed across socioeconomic gradients. This study was published in this month's issue of Environment International, and it's available in open access. So we had 3 specific objectives for our study. Firstly, we wanted to explore the spatial distribution of walkability, NO2 air pollution, and greenness within Canada's 3 largest cities, and how these 3 exposures intersect with each other. Secondly, we wanted to assess how environmental factors are distributed across neighborhood socioeconomic gradients. And lastly, we wanted to identify potentially favorable environments, so postal codes which are characterized by high walkability, high greenness, and low air pollution, what we called sweet spots in the paper, and postal codes characterized by low walkability, low greenness, and high air pollution, what we called sour spots. So to achieve this, we leveraged nationally standardized data indexed to 6-digit postal codes, which are distributed by CANUE. So to assess neighborhood walkability within each city, we use the Canadian Active Living Environments Index, or CAN-AIL, which is a composite index of intersection density, dwelling density, points of interest, and transit stops. And all these factors have been associated with walking rates and active transportation. For greenness, we used satellite-derived normalized difference vegetation index, or NDVI data. Our third environmental exposure was modeled nitrogen dioxide ambient air pollution, which largely estimates traffic-related air pollution. And finally, to assess how these exposures, either individually or in combination, are distributed across socioeconomic gradients, we used the Material Deprivation Index, which was developed by the Institut National de Santé Publique du Québec, which incorporates measures of education, employment, and income derived from the Canadian census. So in terms of our methods, to explore the variations of exposures across socioeconomic gradients, we looked at high and low exposure tertiles across quintiles of material deprivation in each city. And this involved a few steps. So first, we split exposures into tertiles based on within city exposure distributions. And we divided the material deprivation index into quintiles. We then calculated the prevalence or proportion of postal codes falling in low or high exposure tertiles within each deprivation quintile. And this proportion was then divided by the overall proportion of low or high exposure in each city, which is 33%. So this calculation allowed us to determine how postal codes in a given deprivation level compare to the entire city in terms of either low or high exposure levels. The text in blue on this slide here provides an example of how these prevalence rates were calculated for high exposure tertiles and high deprivation areas. You'll understand this a bit better once I present the results. But in this example, a ratio of 1 indicates that the prevalence of high exposure in high deprivation postal codes in a given city is the same as the citywide prevalence of high exposure. A ratio of less than 1 indicates a lower prevalence of high exposure compared to overall prevalence of high exposure. And a ratio of more than 1 indicates higher prevalence compared to overall. The spatial distribution analyses were more straightforward. So we essentially overlaid favorable tertiles, which are low air pollution, high greenness, and high walkability, to identify postal codes characterized by all three, what we call sweet spots. And we did the same for unfavorable tertiles to identify sour spot postal codes. So this table shows the relative prevalence of postal codes in the lowest and highest tertiles of exposure. So these are the columns in the table across material deprivation quintiles in each city, which are the rows here. So I'll go over some of the main findings from these environmental equity analyses. If we look at low material deprivation or more well-off areas, these are the first rows underneath each city label. We see that the least deprived postal codes in Toronto, Montreal, and Vancouver had a 68%, 70%, and 114% higher prevalence of highly walkable postal codes compared to citywide prevalence of high walkability. This is highlighted in green on this slide. Conversely, in most deprived areas, high walkability postal codes were about half as prevalent compared to citywide prevalence, which is highlighted in red here. So this suggests that individuals living in the least deprived areas have more opportunities for active living than those living in the most materially deprived postal codes. In terms of NO2 air pollution, highly deprived areas, so the last rows underneath each city label, were between 18 and 80% less likely to experience low levels of air pollution in each city, and 38% and 23% more likely to experience high air pollution in Toronto and Vancouver, respectively. Finally, people living in Toronto, Montreal, and Vancouver neighborhoods of high deprivation were also about half as likely to be surrounded by high greenness relative to citywide high greenness prevalence. And relatively low greenness was between 23 and 44% more prevalent in highly deprived postal codes of each city. So essentially, these analyses suggested that environmental inequity is occurring in all three cities and for all three exposures that we examined. So now I'm going to show you maps of each city that illustrate how exposures are distributed in space and how these intersect with material deprivation. So the first series of maps of Toronto, Montreal, and Vancouver I'll show illustrate the overlap of high material deprivation postal codes with high air pollution and or low greenness. So the map of Toronto that you see here shows only postal code locations in the highest quintile of material deprivation, combined with high NO2 air pollution, which is shown in yellow, or low greenness, which is shown in orange, or both high NO2 and low greenness, which is shown in dark red. So this kind of map shows the double or triple burden of unfavorable exposure and deprivation. This is the same map for the city of Montreal and for Vancouver. So as with the other cities, we see clusters of unfavorable postal codes. And for Vancouver, these are concentrated in the east side of the city. So the next three maps that I'll show illustrate the distribution of sweet and sour spots in each city. In this map of Toronto, dark red are sour spots. So these are areas where NO2 concentrations are in the top tertile and greenness and walkability values are in the bottom tertile. And green areas are postal codes of low air pollution, high greenness, and high walkability, or sweet spots. I also added randomly selected Google Street View and satellite images to give examples of what sweet and sour spots look like in each city. So this is the sweet and sour spot map of Montreal and of Vancouver. Again, we see clusters of sweet and sour spots in each city. In Vancouver, sweet spots are clustered in the Kitsilano neighborhood, and sour spots are clustered in the east and south of the city. George, you could send the next poll question, please.
Okay. No, just one moment.
Mm-hmm.
So number 3. Here we go. So is it visible? Yes. Okay. There we go. Give it a little bit more to get closer to. We've got 2/3. Can we get 3/4? Okay, we'll end it here.
Okay.
And sharing the results.
So it seems like the overwhelming majority think that municipal planners and urban planning professionals would benefit most from these types of maps. And obviously there's no correct answer to this question. I think all of these all these users might benefit from these types of analyses. But the reason I put this question out is that we recently received funding from the Public Health Agency of Canada to build an interactive application that would generate similar maps and analyses for all of Canada. And we're considering different users to prioritize for this tool. I think these types of maps really show the multi-exposure burden experienced by different segments of the population. And in terms of policy implications, the sour spots identified in our maps could be used to prioritize interventions by urban planners or public health specialists to reduce air pollution, increase greenness, and increase walkability in specific areas of the cities. So for the final part of my presentation, I'll quickly go over Canoe Data holdings and how to access them in case some of you might be interested in using them for your projects. So Canoe holds and distributes data in 4 broad domains, which are neighborhood factors, air quality, greenness, and weather and climate. So a wide array of data are available in the neighborhood factors domain, including the CANUE data set that we use in the analyses I just presented. We also have satellite-based nighttime light data, access to employment data, 2 deprivation or marginalization indices developed from census data, proximity to roads by road type, which may be used as a proxy for traffic-related air pollution exposure, proximity to water, neighborhood gentrification, and proximity to selected points of interest, such as grocery stores, educational facilities, public transit stops, and parks. In the air quality domain, CANUE distributes national level data for fine particulate matter air pollution, nitrogen dioxide, sulfur dioxide, and ozone. And all these data sets are provided as annual averages, and monthly averages are also available for NO2 and ozone. We also hold and distribute NDVI data, which, as I mentioned earlier, is derived from satellite imagery to provide an estimate of exposure to vegetation. And finally, we provide health relevant weather metrics, such as consecutive days above or below a threshold, and a number of extreme events such as heat waves. We also have a water balance metrics data set and a data set of climate zone classifications available for access. Could you send the last poll question, please?
Okay. So here we go.
Thank you.
Okay, we're there. We've just exceeded 75%. And ending.
Great, thank you.
Sharing results.
Thank you. So this question was more out of curiosity, which kind of data is most popular amongst students. So thank you. So I'll now quickly go over some of the technicalities of CANUE data access and use. So first, as I mentioned earlier, all CANUE exposures are indexed to the 6-digit postal code They're available for all Canadian postal codes, and they're provided as comma-separated values or CSV files. And this allows for easy manipulation or import in different statistical packages. CANUE datasets are also accompanied by comprehensive data documentation, which you'll find on the Canoe Data portal at canuedata.ca. Metadata documents give technical information about who produced the data, how it was developed, the time and spatial resolution of the data, and a data dictionary providing variable names, coding, and descriptions. These documents also include any conditions of use, such as citations and acknowledgements. And to ensure that these conditions are fulfilled, all data users need to sign CANUE's data sharing and use agreement. And I should note here that at least one team member applying to access CANUE data needs to be affiliated to a Canadian academic institution. And this is due to the license requirements of the proprietary postal code files to which CANUE exposures are indexed. So finally, accessing CANUE data can either be done directly through CANUE using our data portal, again at canuedata.ca, or via one of the health data custodians holding pre-linked CANUE data sets that I mentioned at the beginning of my presentation and which are shown on the right hand of this slide. Accessing pre-linked data is done via each cohort or admin health data holder, and it's done through the regular data access processes, which are usually described on their websites. So to conclude, I encourage everyone attending the webinar today to access CANUE data for your own research projects. And for more information on CANUE or data holdings and how to access them, you can visit our website at canue.ca or our data portal at canuedata.ca. And lastly, you can also access the paper I discussed in my presentation with the reference on this slide. So I'd be happy to answer any questions at this point.